Welcome everyone. So I'm honoured to be chair of this session, and actually, I'm actually going to do my very best just to shut up. So I'm just going to let it unfold in its absolute splendour. So first of all, I'd like to introduce Jim Green, who's Director of Ops of the British Animal Rescue and Trauma Association. Have I got that right? I've missed out a word. Trauma Care. I knew I'd missed out a word there. Sorry about that. Adam Mugford, your Chief Medical Officer of BSAV Animal Blood Bank, and Nicola Housby-Skeggs, who is Board Chair and Vet Director of Horse Trust. And thank you particularly for stepping in at the last moment. Professor Pollock sends his apologies. He's been unavoidably detained today. So the thing about BARTA, and from an outsider's point of view, I mean, I was in clinical practice for 28 years, and I was called out to sort of road traffic incidents in Fife, in London, in Glasgow, and it was always slightly kind of nerve-wracking at the time, and I felt I did have to go if it was called, but sometimes I wondered about these civil emergencies, and sometimes you see these big catastrophic situations. I thought, how would I cope with that? Who's in charge? Is the vet in charge? Is there someone else in charge? And how can we get together and start to pull all that together and provide a coherent response? And I think what you guys are doing is terrific. You're doing really good work on that score. So on that, I'm just going to let you let rip.
Thank you very much. Good afternoon, everyone. It's a real privilege for me to be here today because I'm stepping into your world for a short period of time. My background's in the Fire and Rescue Service, before that forestry. So I'm a country lad from the New Forest in the south of England, and when I joined the fire service I suddenly found myself getting involved with a subject that I had something to offer, and that we didn't have very many skills in the emergency services to deal with animals in distress, and we started to form some protocols and procedures, and I look back now and that's over 25 years ago. So we've come on a long way, and BARTA really was formed out of that early work with the Fire and Rescue Service, and particularly as we understood the need for many other professionals to be part of this solution, whether it's preparedness or response or recovery when people and animals are involved in emergencies and disasters. So I'm going to start off with just a couple of slides just to outline the mission of BARTA, sorts of things that we do. And then we've got a series of questions that we're going to run through, and we really would encourage you to participate and ask questions or give your perspectives. And there are some really important people in the room today who will be able to take us to the next stage of our journey. And so, as I say, it's a real privilege to be here. So BARTA's mission, we're just actually in the process of rewriting our mission, but essentially we're looking to establish a society where animals are safeguarded alongside people in emergencies. And so BARTA will empower communities to improve animal casualty outcomes and protect human safety at instance through a range of different outputs. And the first of all, leading expert-informed best practices. And what we recognised very quickly was that one viewpoint was not enough. We needed to know what this looked like for the emergency services, what this looked like through the lens of the veterinarian or the veterinary surgeon, and also what does this mean for animal welfare. And so we hold engagement sessions to identify the needs of operational agencies, and we then have working groups using experts from our stakeholders coming together to help us to inform best practices. And that can be through consensus or through scientific evidence base. We also deliver a lot of technical training. Since I started this, there was a real need to train emergency responders. It's no good just talking about this. Animals are very unique when it comes to an emergency. They're not like people. They don't behave like people. And so our emergency responders really need to understand the hazards that they're dealing with and how to get the best out of that situation. So we do a lot of technical training, which involves techniques for rescue, it involves animal handling and psychology, and it also involves integration of the veterinary component to help them to make good judgments operationally. We also need to foster strategic partnerships, and we have a range of different agencies that we're involved with. This very much is a stakeholder-led initiative. And the picture you see here was when I very first met Professor Josh Slater. He was the president of BVA back in 2007. And we launched some emergency services guidelines at Buckingham Palace with the BHS and with BVA. This was when I was in my fire service role. And Josh at that time really kind of highlighted the fact that vets were significant in resolving the situations that we were dealing with, but there was very little training in place or awareness for vets. Just as Neil was saying, it can be quite a lonely place for a vet to turn up at a multi-agency event feeling that you have to come up with all the solutions. And that's effectively what was happening in days gone by. We also want to provide education and support for other emergency and welfare professionals. Just some of the pictures there. We're up at the Defence Animal Training Regiment at Melton Mowbray. Just this week we had a meeting with the Army to align their instant response throughout the military regiments. We've been working with the military for many years. Nikki was a veterinary officer in the Royal Army Veterinary Corps. She was responsible for embedding rescue techniques into the Household Cavalry and the King's Troop Royal Horse Artillery. But just now, they're actually looking at the wider scope of dealing with incidents involving animals and what their future might look like. We were asked to go to Bristol Zoo not that long ago. So there are a whole range of things that we might get involved with. This giraffe was going through a procedure, and they wanted to relocate the giraffe during the procedure, and the techniques that we've developed through the rescue initiative are really, really fundamental in supporting a casualty relocation, whatever the animal. And we've done a huge amount with British horse racing over the last few months. We've trained over 400 racecourse staff, so our ground staff that are going to be performing the casualty relocation or dealing with people that are trapped under horses. These are all very familiar for me in the emergency services, but we're translating these skills into these other disciplines. And I was very privileged to be at the Paris Olympics as well as the London Olympics. Paris Olympics this year, leading the response team for the cross country. And finally, integration of animal welfare into emergency planning. Emergency planning in our country focuses on people, and what we're needing to do now is to really help them to understand the nature of the animal component and the way that animals are intrinsically part of our society. And vets have a fundamental role in the future of our response and planning. So I suppose the first question was, well, how often does this happen? Why do we need to be involved with it? I've been an animal rescue responder in Hampshire Fire and Rescue Service for the past 25 years. And I've been to hundreds and hundreds and hundreds of incidents involving animals. Predominantly, we started with a need to gear up for large animal rescue, mainly horses in distress. These are some common incidents. When your horse is upside down in the trailer going down the A303, you pull into Amesbury Services. Your horse is still upside down in the trailer. What do you do next? You know, and now we have a formal SOP where our fire service, animal rescue team and our vets will be attending to help resolve it as a team. If you're on the M27 and you've got a crash between junctions 1 and 2, who's going to resolve this? Well, these sorts of situations are happening on average 1 a week in my county. So there are 50-odd fire and rescue services in the country, most of whom will be doing a similar number of large animal rescues. But we also deal with a range of small animal incidents. And when you think about the national framework, there really isn't anything in place to determine which emergency service needs to be part of these interventions. So when your West Island Terrier gets its tail trapped in the stair lift at 11 o'clock at night and you're in your mid-80s, who do you call? Okay? Because we not only have to deal with the trapped animal, we need to sedate this animal, we need to take apart this stair lift, isolate the electricity, but we also have to deal with an owner who's been bitten and who needs medical care. This is quite a common one in the top here when animals are in reclining sofas and chairs. You sat in your chair, you press the button, and what makes your chair recline is a motor and a worm screw underneath. And animals that are going underneath, whether they're rabbits, cats, dogs, then the worm screw grabs their skin and drags them into the mechanism. This is happening quite frequently. Very traumatic for the people at scene, very traumatic for the animal. Cats between walls. Yes, it's not my favourite job because cats have many weapons, and I have been, I've had to learn over the years. But stitch drilling a cat out of a wall with a Kango hammer is pretty stimulating and quite upsetting for that animal. That's very traumatic. Then there's the wildlife side of things, and this presents even more challenges because we have animals that are not owned. We have animals that may be non-native species, where legal implications will impact on our tactical decisions, and where euthanasia may be the best option for many of these situations. And again, one a week generally. One a day. Then we have the oddballs like the loose rear, the tawny owl that's come down your chimney and is flying around your living room with soot going everywhere, the pigeon that's stuck under pigeon netting that's supposed to keep the pigeon out, and members of or people from the pub spilling out and wanting to climb on the roof to try and rescue it. Reticulated python that when it gets hot come out of their vivarium and then end up in people's homes because they come up through the plumbing, and someone goes into their bathroom at night and finds a reticulated python in their makeup drawer. Doesn't go down well, And what happens when you hear rustling at 2 o'clock in the morning and you come downstairs to your downstairs bathroom and there's a badger in it? We wasn't quite sure that this wasn't a hoax, but she took a film of the badger leaving through the cat flap. So these things are happening in our society. And then we start looking at some topical things. Hurricanes and high winds and other climate emergencies are leading to many incidents involving animals. So fires are fairly frequent in animal housing anyway. Animals trapped by fallen trees. And then this is very, very common now, is animals that are marooned or animals that are in water or indeed animals that are in people's homes that need to be evacuated with their owner to a place of safety. And essentially what we recognise now is that this isn't just limited to animal rescue. This isn't just limited to the fire and rescue service. Any emergency responder or any support agency that have to interact with people during unwanted events will be interacting with animals. Dogs in house fires. We had 2 this week. This one at the top left is a deer that was over a cliff. Now, you need to have quite specific guidance to deal with deer that are over a cliff. Car crashes, water, dogs in cattle grids, and things like dogs in hot cars. But when there's a nice label and a poster that says, if you see a dog in a hot car, dial 999, you want to be sure what the result is going to be. Who is going to respond? Who is going to take that responsibility? Who is going to resolve it? And who is going to ensure that the welfare of that animal is protected? So that's a little bit about where I'm coming from. So I'm the director of BARTA. I set BARTA up with Professor Slater in 2012, but I've been an animal rescue responder and tactical advisor in the fire service and remain so. And these are the type of situations that we're dealing with daily. Now, I'm very accustomed to working with large animal vets. We've recognised for some years the importance of large animal vets. But the question really is, how do these different types of incidents impact on animal welfare and veterinary practices? And Nikki, as a large animal veterinary responder, what does that look like for you, Nikki?
Yeah, so as Jim's very generously called me a large animal vet, I definitely just do horses, but the odd cow has crossed my path. So I think one of the big things is that this is very much the context of what we're being asked to do is really different. So you're very used to having your list of appointments. You'll put what you need in the car for the day, and then you'll go around your various appointments. Now, inevitably within that, you do get called to the odd emergency, but you kind of know that's normally going to be a stitch up or a colic. So you're kind of prepared for those what we call routine emergencies. What you're perhaps not set up for when you've got this sort of incident here, I think it was 8 or 10 polo ponies in the back of this lorry, you're not necessarily set up for dealing with mass trauma essentially in 10 animals. You don't, the amount of kit you need to carry in your car for that on a daily basis just becomes it's not a feasible thing to be doing in terms of stock management. So I think that's one of the big challenges, is that even if you kind of know what you're doing, you might not have the right stuff. So there's always going to be this requirement for some form of backup. So it's a bit about actually other practice prepared for this. So I could be driving along quite happily and someone says there's 10 ponies in the back of a lorry, and you think, well, that's going to slightly delay my next vaccine appointment, but here we go. But then it's that ability to ring the practice and to say, I've got this incident, I'm going to need all of this stuff, and then to sort of be able to reel off all that stuff you're going to need, because inevitably you'll forget one thing, and an angry nurse then is kind of like, you forgot, you serious? You've forgotten that? And you, yeah, I have. So actually having those kind of checklists. These are the things we're going to need. If it's 5 horses, this is what we're likely to need. If it's 10 horses, this is what we're likely to need. So we can actually phone the practice and say, I've got an incident with 10 horses involved. Can you grab the checklist, get all of that kit together, or even have that kit sort of ready to go as and when you need it, but someone can run through that checklist so you're not trying to remember all the things you're likely to need. I think then the other big thing is a small animal, I'm not saying it's necessarily easy to contain, and I share Jim's view on cats, but inevitably they are small, so they can be put into something quite easily. It's unlikely you've got space for 10 polo ponies to just kind of, we'll just bung them in the back of the car while we work out a plan. So there's this containment issue, and there's this pressure because this was quite a hot summer's day. So you've got frightened and injured horses, you've got frightened people, but also this box is getting hotter and hotter and hotter with injured animals inside it. So there is a time pressure in terms of your casualties to get these casualties out. But then what you don't want to do is open the back of that, release 10 polo ponies onto the 303 into oncoming traffic, because suddenly you maybe have less casualties, arguably, from an equine sense, but you've probably got a lot more human casualties all of a sudden. So you've really escalated a bad incident into a real problem. So it's then thinking that through, and again, we've dissected this incident over and over, but you then look at this and say, well, okay, do we just get another lorry that's going to fit 10 horses on it and we can take them out one by one? But the first horse that comes out that's maybe okay might have to then wait a couple of hours before you've managed to extricate the next one. So then you've got another lorry that you're putting them onto that's getting hotter and hotter and hotter. So actually you're not really, so think about these, do you actually need 5 trailers where we can move a couple of animals at a time? So there's a lot in this, which actually when you've had the luxury of looking at these incidents over and over and debriefing on them, dissecting them, I think, if I get called to a polo lorry with that number of horses on the 303, I will know what to do. But it's not going to happen to me, because I'm going to get, 6 cattle and a badger, and suddenly it's on the M4, and you go, I didn't prep for this one. So they're all going to be slightly different. So it's then kind of making sure that those resources we develop are broad enough to cover all of those different types of incidents.
So historically, when we've wanted to call a vet, we've had the BVer register in days gone by. We also have an idea of where our local large animal practices are. But you generally go, we need a vet to come to this incident. This type of mass casualty situation, Nikki, kind of how many vets or what type of veterinary professionals are we looking for here? What sorts of roles we might need from them?
So, yeah, again, I mean, you need more than one person that knows what they're doing effectively, because if you are the vet on the scene, there's going to be a lot of questions coming in, there's going to be a lot of decisions to be made, and it's very difficult to be making those decisions while you're looking at 10 casualties. Excuse me. So what you really need is a team of veterinary professionals. Now that might be a team of a couple of vets and a couple of nurses. It might be that you need 10 nurses and a vet, and probably more likely 10, well, actually no one wants 10 vets at a scene, let's be honest, that's a bit of a disaster waiting to happen.
10 opinions?
But, yeah, why not? So you need to think about that team, and actually one of the big skills, especially when you're looking at mass casualty, is that ability as a vet we're very used to. We've got one horse, blood everywhere, we're going to stop the red stuff coming out and we're going to do something to make this scene better. When you've suddenly got 10 of them, as if you are the single vet on the scene, most likely what you're going to need is to move into a mass casualty triage scenario. So you're really looking at which of these animals is viable with the resources and in the context. So it might be viable if it's a top hospital, but is it viable? Can I do something for this animal? Or actually, do I need to make a decision to euthanize this animal so I can focus on these others that have a really good chance of survival? And that's quite a big skill, to step back, to be able to look at that big picture, triage those animals, make rational decisions, and do the doing. So I think having a team of nurses, or a couple of vets, a couple of nurses, but one of those people needs to step back and be the decision maker.
Yeah, so this job here is one that I dealt with. Unfortunately, we'd spent some time looking at livestock transportation and equine transportation. We've done a whole study on it. We've done films. So we had a good idea of what we needed to do. But the other responders on the scene didn't really have a clue what was needed. And so there's a real need to get people together, to get them on the same page, and to brief everybody as to the needs of that incident. And it was quite a challenging. I've got 2 hours of GoPro footage of me getting absolutely wrung out trying to manage this incident. But the picture there is us having a multi-agency briefing, getting everyone on the same page. Now, the good thing about this job was that the 2 vets that turned up initially had training with us in the past. This guy here, you might recognise, it's Chris Tufnell, who was past president of the Royal College. So Chris and I have got a relationship anyway because he's in my local area. So we were able to very quickly formulate a plan. We knew what our expectations were. And then at some point during the rescue, the vet associated with the polo team turned up. And that then changed the dynamics because he hadn't had any training. He had his own expectations about what needed to happen, what he could do. And that didn't really fit with what our plan that was playing out involved. The other thing was this whole idea of trauma care, because we're quite we don't want to change. You're all vets. You all know what to do in a veterinary context. And as Nikki said, what we're just doing is taking a vet and putting them in a different work environment with different people to navigate. But also that comes with some challenges in veterinary care delivery. So we wouldn't be allowing anyone into this box because the horses were all wound up inside, and if we open the door, as Nikki said, the containment would be compromised. And so Chris had to euthanize one of the animals that had snapped fetlocks and was causing a lot of this wind-up. He actually had to improvise a remote injection pole and euthanize it off the top of a ladder through the little window in all these steamy conditions with loads of horses that all look the same colour. He actually had to improvise the euthanasia of the animal that was causing the major issue in there, to relieve suffering, but also to prevent further complications. And so really having to think on his feet. Now, one of the challenges that we have is when a newly graduated vet comes out to that scene and you've got someone like me there saying, right, hello, my name's Jim, this is what I've got, this is what we're looking to achieve, blah, blah, blah. It's very normal for me and have those conversations with the vet. If the vet has not been prepared for this, it's very, very challenging. And it does have a toll. Even experienced vets, this will have a toll. John Blackwell, a good friend of ours, attended a cattle lorry incident some years ago where there was human fatalities. And it was on a viaduct. The cattle lorry rolled over. The ramp door ejected the first compartment of cows over the viaduct. It was really terrible incident. And John openly says, 2 years down the line, he hadn't processed that. So we're really, really keen that the vets are part of our debriefing after that incident to ensure that the support has been given to them. Because it's a big factor in the emergency services now, our team's mental well-being, and something that Nikki has also been very involved with the military in terms of that whole kind of debriefing process. Has anyone got any comments about the large animals incidents and or any experiences or anything that anything you feel has been improved over the years or needs improving? I don't know how many large animal vets there are. David?
I was with John on the viaduct
Of course you were.
I was with John on the viaduct, and one of my younger colleagues 2 weeks ago had to attend a horse box that gone over where the driver was sadly killed. But there's much, much better support for her dealing with that than there was when we did the viaduct. However many years ago that was. But it does really affect us, and we need to be aware as veterinary professionals we'll cope with the fact that there are a pile of dead animals around, or we need to euthanize part of dead animals. But we're not quite so good at dealing with dead people. And working at viaduct, working on that lorry for 12 hours, knowing the driver was sat in the cab because no one could get him out, was really pretty horrific.
Yeah, and the other thing is that emergency responders really don't like it when animals are in distress. You know, so there is very much a need for our two cultures, and this is really what I've done over the years, is to just bring two cultures together and recognise each other's priorities and what drives you. You know, so for the firefighters, you know, we turned up, it was a challenging job, but we would go back and debrief and crack on, but we would do that as a team. You know, the vets were turning up with a stack of clients behind them, and you know, people ringing them up and all these other things that we wouldn't, as emergency responders, be aware of that pressure on you. So as much as we can do to be aware of how you turn up and what your needs are, that's going to support everybody. Okay, so
I was just wondering, because obviously if you dial 999 and you're involved in an accident, you get whipped off by ambulance or helicopter or whatever, and there's no cost involved. But I just wondered, with the fire and rescue service with these large animals, whether in fact you charge the owners at all for the work that you do, or the vets that turn out.
it's a really important point, and it's one that we've wrestled with over the years. And I don't think we've ever had a situation where a vet has not turned up to the incident, but there are situations when it's very difficult for the vet to reclaim their expenses. And that's why the British Equine Veterinary Association established a fund back in 2007, which was kind of a fallback if the vet could not find the owner or could not get their expenses paid. The Fire and Rescue Service have been reluctant to talk about paying vets, but we will move on shortly to a piece of legislation which forms our civil contingencies preparedness that mentions vets, and it talks about this whole idea of contractual arrangements. So if I may, I will just park that and we will bring it up in a minute, because it's a really, really important question. So, Adam, I do lots more small animal rescues than I do large animal rescues, and I think we've done it in a certain way for many years. But I think there's a better understanding that we have a duty of care to those animals. What does that look like from the veterinary profession?
Yeah, that's a great question. So I chair the BARTA Small Animal Advisory Group, so that's trying to bring experts together to guide the guidelines and frameworks that we come up with to work with the emergency services. So all of the small animal vets in the room, you get a phone call in the middle of either a busy evening surgery or you're a sole charge out-of-hours provider. What do you do? How do you get to the incident? What do you take with you? What team can you take with you? If you're in central London, the middle of Newcastle, do you even have a car? Did you come by public transport, the underground? How do you get to the incident itself? We obviously all know, well, many of us in the room, the RSPCA obviously has funding challenges. And so the vet line now closes at 8 p.m, and that's the line that the first responders also use. So there is no emergency service for animals to bring them to you. And as veterinary surgeons, we're obviously obligated to pay attention to animal welfare, and that should be our first concern. But of course, if you've got a GDV that needs to be on the table, and I'm an ECC specialist, so I'm not doing these things myself anymore, but I used to supervise 4 hospitals in and around London. And so if you're getting these calls in the middle of the night, how does your vet on duty make that decision to leave, and leave potentially animals that are unwell and attend? And that might be animals in quite severe distress, the examples that Jim highlighted. Of course, you also need to think about those of us in the room that work for some of the larger out-of-hours providers. That's had a knock-on effect. It's great for the people working in those teams. It's great for the people in terms of the level of training they have to provide emergency out-of-hours care to clinics, and allowing those of us in the profession that don't work out of hours that downtime to be on form the next day. But in effect, we've gone from a model where every practice in the town was available to the emergency service to phone, and they would just phone round until they got the person that was free, to a model where there are 2 practices in quite a large metropolitan area that are providing out-of-hours care. And they're then dealing with the clients of 20 or 30 practices. So the chance of them being able to leave is less. And if they're not available, there's only one other phone number to phone in that town. And that might be a small animal incident, or what would be common as well is also being asked to attend a large animal incident, because in some urban areas there aren't large numbers of ambulatory equine vets, there are no farm vets. And we may touch on it later, but we might have seen the news last year about the calf running around a town in Surrey, and how that was dealt with, if you're aware of the situation, may not have been appropriate. So with better planning and collaboration, one thing we don't ideally want to happen as a profession is a police officer or a first responder calls a practice and they say, we can't help you. And that's the end of it. What potentially we would want to happen is that vet helps the emergency service then find the most appropriate person to respond, directing them to an appropriate person who could respond. And in the larger organisations, perhaps planning with their vets how they might do that. We obviously plan how they might respond to a house call to a member of the public with their own pet, but how do we help these unowned animals, or in other situations where the owners of those animals have gone off to hospital themselves, and then the emergency teams are, under the Animal Welfare Act, responsible for the welfare of those animals. And until they get them to care, they've got a challenge. Another thing is, as a small animal vet, Nikki has a safety helmet, she has a go bag in her car, she has all of the materials ready to provide that immediate response. But in a practice, you may have a house visit bag for euthanasia, but do you have all the materials that you would require to be away from your practice inside one of these cordons and not forget something? So again, checklists. Also working with large animal vets to educate them about the doses you might use for a small animal. So you could respond to one of these incidents, but if the last time you sedated a cat was 25 years ago, and you've got your syringe of ketamine of 30 mils, 20 mils,
Yeah.
And then you need to apply that to a smaller animal, how you go about that. And the fellowship working together to advise on that would be key. Those ethical challenges, leaving a clinic to provide care to an individual animal and then not providing care to a group of animals is a challenge for small animal vets. And how you go about that personally is a challenge. I think there's a massive opportunity, and we touched on that already, how we can use the veterinary team of professionals to respond as well. We have a great body of veterinary nurses who would be a key part of responding to this, but often, obviously, they're not with a vet on site. They perhaps could get there even quicker. You may be able to free up a nurse to go to the site, and could, by working with the emergency first responders, could those nurses be empowered to deliver fixed dose sedation, for example, so that animal's welfare is then protected, so it can be removed from the wall, the engine block of a car. And there are many examples where Barter is made aware that the emergency services are waited for 5 hours on the busy North Circular, for example, with a non-viable cat which had complete degloving of its skin from an engine block. And the first, second, third practice have declined to respond because of reasons around being able to leave their clinic. And so clearly there's a larger team than just the individual vet that could respond to that. Obviously, we often talk about revision of the Veterinary Surgeons Act and how that might happen to enable nurses to be empowered to do that. And in many, America, for example, they rewrote some of their federal law or state law to allow emergency first responders to provide more care themselves. They're highly trained, and the more you work with them in terms of advanced life support for humans, But often they might be sat there with an injured animal and they have the skill set to do some of the procedures that we would say are veterinary procedures, but clearly if trained and regulated in the appropriate way, that can expand the care that the animals might get. And we'll touch on it later about the economic impact of some of these instances as well. Mental health as well, obviously, if you're a small animal vet and you're faced with injured farm animals, but also you've then had to euthanize a number of animals, you've got the injured people as well. Often you'll go back to then put your smiley, happy face on and vaccinate that puppy or kitten straight afterwards. So the debriefing can be key to recovery as well. And I think the large animal, small animal has a lot of overlap. But the fellowship working together to improve the pre-veterinary care guidance, but also the Royal College working to improve the regulation to enable the whole veterinary team to respond is probably key as well from a personal perspective. But
Thanks, Adam. Has anyone got any examples or opinions on from a small animal perspective? Adam, got the...
Thank you. Just a quick question about, so you mentioned there's you in where the New Forest and there's 50 other regions. Are there 50 of you around? So
No one would want 50 of me. So really good question. And when I started this journey, our primary need was to have a response to large animal rescue. So that in the old days, it was how do we physically move this horse or this cow out of this slurry pit, ditch, bog, whatever it might be. We then established a set of techniques and some training, and most UK fire and rescue services have established a team or teams within their local authorities that can deal with large animal rescue. Now, back in 2017, we wrote some national operational guidance for the Fire and Rescue Service, and it changed the language from animal rescue to incidents involving animals. And that then opens up a much broader scope. And they are still on a journey to understand what that looks like for their teams. So if it's large animals, they're trapped or they're loose, that seems to be quite well sorted now. We got the team, press the button, they mobilise. But when it comes to, we've been requested by the ambulance service to kick down a door so that the ambulance team can gain access to an unconscious casualty lying on a bed, and there are animals in the property. We are finding more and more opportunities for people to get bitten or have to interact with other animals. Now, that's not animal rescue, that's the management of risk to deal effectively with what is our statutory duty. And it's very difficult for a paramedic to go and jump up and down on that person that's dying when there's an animal there that's trying to protect their environment or their owner, or they're just scared because all these people are now broken into their house. So we have a long way to go in relation to our interactions with small animals. I showed you the pictures of the snakes and all these other, exotics that people have. Justine's here today. We did some work, some foundation training some years ago, looking at, the different types of animals in people's homes. Fires, medical emergencies, car crashes, people are transporting and keeping animals, and we are interacting with them. And we currently do not have effective guidance for emergency responders. It's a big void at the moment, and we really do need to continue these working groups to plug these holes, these operational holes that we have. I was even talking with Border Force recently, and they were saying that when they do raids and they have to seize animals, finding almost like a green yard for those animals to go to at whatever time in the morning. These things are challenging for them. We need to have people from the welfare professions engaged in helping us come up with these solutions. So yes, it's a really important thing that not very many services will have a robust way of dealing with small animals.
Right.
Cool. Anyone else? So.
Yeah, I'm thinking of these vets doing emergency duty either mostly now in an out of hours clinic, and I think they have two other problems. One is they may not feel empowered by their employer to leave the business and attend a non-client, So you're right, absolutely. There'll be a protocol of some sort. Do we tell people to bring their pet in if it's under our care, or on what circumstances are we allowed to leave, and what's the system? But they won't feel empowered to go at the request of the police or the fire brigade to leave their post. And I don't know, I suspect they feel their employers may not support them. So perhaps, and I don't know, not having worked in one of those businesses recently, is whether the employers have a strategy and whether the employee, who is a professional nonetheless, but whether they feel that they would be in trouble. And secondly, what the Royal College would make of their action. We all know there's been a number of incidents of emergency work, not involving this, but involving care of pets, where veterinary surgeons have found themselves subject to disciplinary, sometimes unfortunately adversely. And so I think there's a lot of reluctance for people to step outside their normal role because they worry that they'll be subject to an unfortunate disciplinary. So there's those two aspects. I think many of these people are employed, and those major employers, I don't know, perhaps do need to have some guidelines that are accessible and at 2 o'clock in the morning. And also people need to feel that the Royal College will support them or judge them fairly rather than judge them harshly.
Absolutely, and I think that obviously the regulation and the professional oversight applies to all the professions involved. The police forces have similar situations where they need to respond appropriately. It's a great segue into the next section, which is obviously Jim will probably start to cover how the emergency services see its responsibility, but how that interacts with us as a profession as well.
Thanks, Adam. I didn't pay you to line those questions up, but it's absolutely perfect segue. So, the legal framework that kind of establishes our country's response to emergencies is called the Civil Contingencies Act. And this really outlines the type of risks that we may be interacting with and the type of responders that we need to support us. And we talk about Category 1 responders. Category 1 responders are effectively those people who will down tools and immediately go and deal with civil emergencies. And these are the blue light services predominantly. We then have Category 2 response groups who are people that will support Category 1 responders in doing their jobs. Utilities, all the companies that need to get our infrastructure working, even people like the Met Office in giving us accurate guidance on what weather-related issues we're going to be facing. So there was some revision to the Civil Contingencies Act, and this was looking at other sectors that we might need to engage with to help us resolve emergencies. And so this is a Cabinet Office document, and it was revised in 2011. So this text has been around since 2011. And it talks about the role of private veterinary surgeons. And it says, private vets may be called to the scene of an accident or emergency to provide emergency veterinary assistance to relieve pain and suffering and to protect animal welfare. Access to veterinary care may also be required for companion animals displaced along with their owners by incident. Considerations including any necessary contractual arrangements, as the gentleman was talking about, should need to be included in Category 1 responders' planning arrangements. And Category 1 responders should also consider the need for training for veterinarians who may be called upon to assist in large animal rescues. This would enhance the effectiveness of joint working as illustrated in the National Incident Command Protocols and National Animal Rescue Guidelines, which is the Fire and Rescue Services guidelines. So could I just have a show of hands? Who was familiar with the fact that vets were talked about in our civil protection legislation? Sheila, of course, as Chief Veterinary Officer for Scotland, will be all over this. And Sheila attended, we had an international conference in Glasgow this June, where we had 100 people from around the world who were involved in similar initiatives coming together to form an international community of practice where we're going to support each other in taking on some of these bigger questions. But it's quite useful to know that in some ways we have some backup to say, vets are really significant in helping us to fulfil our duty of care under animal welfare legislation and to relieve pain and suffering, but also to deal with those situations where people are displaced from their communities where their animals are displaced, because effectively, you know, we are so inextricably linked to animals that if we are impacted, they are impacted as well. And so this is a really important thing really to start with, to start to have a conversation about what that looks like. Because we're saying here we want private vets to rock up at an incident, but then all the things that you've outlined, all the challenges that Adam's talked about, start then to become a topic of conversation, because there are many. It's very easy to write a report for local resilience and say, oh yes, in the event of an incident we need to get a vet to the scene. When you actually start looking at how difficult that is, then that's the conversation that we need to have now. And I really take on board your point about the Royal College, and really this is why this is such an important opportunity, because you as senior professionals in the UK can have a real voice here when it comes to what are our expectations, what does it look like for the emergency services, but also for our community to receive the veterinary care that we should have at an incident. So is there anything, Adam, you want to?
Yeah, I mean, of course, we have our practice standard scheme, and we were fortunate in the last review to add a knowledge of the emergency services and the need for a response, but in the awards level. So it's very optional, so the practice could take care to learn about that or not. Clearly, we highlight here that it's actually part of legislation, and we know that things that enter the core practice standards, I'm on the practice standards group, which is why I have a sort of idea of some of the discussions we have, but at the core level, that's anything that's legal or health and safety. So there's a lot of opportunity there to say that this is, to some extent, a legislative requirement, that there should be better knowledge. And whether that's built into undergraduate training so that people have an awareness of when they might be called upon. Because these are often stressful situations. So if you've had pre-thought and pre-planning, even if you're not sure 100% what to do, you'll be less stressed about it, of course. Equally, under the Code of Conduct, it's in section 19, where we talk about what a first responder might be able to do in an emergency situation. When you get down to it, it says under Schedule 3 it can be the same as an owner, which is subcutaneous injections or oral medications. And I don't know about any of you guys, but I wouldn't want to give any of those animals oral medication to try and address their pain or suffering. So clearly there's some limitations there that a highly trained emergency professional who's had very stringent training to provide human medical care could clearly provide certain aspects of care above and beyond which an owner might want to do. So clearly there's options for rewording that there as well. And it's in both equine and small animal sections in terms of the advice that the practice standards provides, but it doesn't really get covered so much in large animal medicine, where perhaps the risk of an adverse event or the impact on a whole community could be so much worse. So there's definitely opportunity both within the Code of Conduct, the Veterinary Surgeons Act, and of course practice standards as well, to try and purely raise awareness and highlight the importance of this and the negative impact it might have on animal welfare, but also on the public perception of the emergency service, but also us as vets in practice. If we get the level of response that we provide in a timely manner wrong, it very quickly enters the popular news media, social media, Facebook, all of those things that can cause practices and us quite big problems. So there's lots of opportunity to improve this section of our responsibilities as both first responders and the preparation we provide, the thought we put into how we work together, the guidelines we have to make co-working efficient, because you can get back to your practice quickly if you all know what you're doing, so things happen more quickly. But yeah, and obviously this leads into some other aspects of planning which are very important.
So back in kind of 2011, there was some consultancy happening by the Farm Animal Welfare Committee for looking at disasters and emergencies involving livestock. And this was printed in 2012, the opinion on contingency planning for farm animal welfare. And I'll just highlight two aspects from that report. Firstly, from the evidence collected, it appears that specific contingency plans for farm animal welfare during non-disease emergencies at national or EU level do not exist. Secondly, from the responses received to the consultation, it appears that the Fire and Rescue Service is the only emergency service that's focusing specifically on animal welfare, and then only for localised incidents. And I think that's a really important thing, is that our teams are based on the numbers of people and the skill sets to rescue that one animal from that one entrapment. When we start to look at a wider scale incidents or major incidents, it requires more resources, more skill sets, not just from the rescue services, but also from a veterinary perspective. And I was, again, I've had some really special times in my career. I was asked to go to UC Davis for a year to work in the vet school. And they had a program for, it was kind of a sideline program for animals in disasters, and they were trying to get engagement with the fire and rescue services over there. And I went over for a year and worked in the vet school and was doing a lot of collaborative working. And at that time, the university wasn't really focused on disaster work. They had other priorities. And so it was still, you know, something that wasn't core within their thinking. And then that year, and then subsequently, there were some significant fires that happened in the Northern Californian area. And that impacted majorly on communities and on animals. And so soon after that, the state governor mandated the university to develop a Californian veterinary emergency team structure and a training program. And they give $3 million a year to that program. And the team from UC Davis came over to the conference, and we're talking about the CVET initiative. But from 4 or 5 years before that, having no real, this wasn't on their radar at all, to then having a massive issue to deal with within their state, and having to bring in vet support from other states to uphold them, they thought, you know, we need to do something ourselves. This was replicated by the Australians. You know, they've been dealing with a lot of flooding over the last few years. You know, and if you ask them, you know, whether this was on their radar 6 years ago, they'd have said no. So part of the discussion at the conference was around our adaptation to climate change and our expectation that there are going to be wide-scale and significant events that we as our community are going to need to have to prepare for. So going back to the small animal context, there's a big difference between mobilising a single vet resource to deal with a cat in a window than there is to mobilising a whole vet-led team to deal with communities that are displaced. In Northamptonshire, 3 or 4 weeks ago, they had to evacuate a caravan park. There was about 1,000 properties in the caravan park, and 22 households needed to be sheltered with their animals. Others would have gone elsewhere with their animals, but when we're thinking about the numbers of animals in our community, I think since COVID it's risen to something like 63% of households have animals. You know, and so it's really important that we have measures in place to deal with them. You know, we say that we've got, you know, significant disease control measures and contingency plans, but there is no government framework for this wider issue of emergencies involving animals. And going back to the comment about, you know, the role of the vet and whether they're allowed to respond, whether they want to or not, what we don't have is that mandate from government to say we recognise communities are made up of animals and people, and in our planning, our local resilience measures, we need to have effective plans for the animals that will be caught up in those situations. So this is really about establishing that national responsibility for animal welfare in emergencies and disasters. Because at the moment, all emergency planning focuses on people because that's what they think is their steer. That's what they think they have to do. Is there anything you want to add, guys, on that?
Hurricane Katrina, for example, you'd think that most people would want to escape a hurricane coming at their house. And in the data in the US, just over 40% of people refuse to evacuate because their animal would have been left behind. And the average amount of evacuation time from a flooded area will be 3 days. So these people that do evacuate, less than 50% of them had a pre-preparedness plan. And so if you're not prepared to be out of your house for 3 days, but you're going to refuse to move without your animal, then one of the reasons the emergency services do respond is because if they don't respond, people will take unnecessary risks. And then if they don't go and rescue the animal or help remove the animal, they'll then have people to rescue as well. So they acknowledge that if they don't care for the animals, the people will be a lot harder to deal with. And In Yorkshire, there was a dam about to burst and about 20,000 people were evacuated. But, there was probably, based on the percentages in the population, 10,000 animals to deal with as well. And it was hundreds of animals after that incident that were lost and needed to be rehomed, and organisations had to go in to find those animals and reassociate them with their owners. Of course, as vets, we all know that many of those animals will have conditions as well. They'll need food, they'll need housing. Some of them will need medications that might need storage, diabetics. And if you're out of your property for a week and your town's veterinary practice has also been evacuated, you can't just drop them off at the nearest practice. Suddenly your nearest veterinary care is in the next town. It's not necessarily just affecting the households in that city, it's affecting all the practices as well. And so you need to bring in resources from outside that area, and how you do that in the UK is obviously flooding, all the incidents, wildfire. We were at the conference in Glasgow. The Environment Agency did a very hard-hitting hour-long presentation on their assessment of the risks of flooding and fire in the UK. And we think, California, they have a plan, Australia has a plan, because the environment likes to cause a major disaster every year there. But in the UK, the chance of that's becoming a lot worse, and it's going to affect small animals, large animals, unowned animals as well, and preparing for that is really important.
Yeah, I think... Oh, sorry, go on now.
No.
I say the other thing that I think is, especially when you think about how are you going to manage one of these big incidents, is it often falls in the too difficult box. So what happens is people start a bit of a cursory plan. So as an example, we where I work at the Horse Trust, we sort of had a fire evacuation plan, but it was very very sketchy. No one really knew what it was. Everyone sort of thought they knew what it was. And we did a big exercise earlier this year where we actually made a fire evacuation plan and we actually ran through it. We didn't set fire to anything, which Jim was a bit disappointed about. But and when we sat down with, it was probably about 10 or 15 of us sat down and we really worked through what is that going to look like? What are we actually going to do? The plan we came up with in the end was, we've not had to use it, thank goodness, I hope we don't, but it worked. When we then went and did it, it actually worked. But there were a lot of, someone would say, oh, well, of course, we'll just do this. And when you actually look at, well, what will that look like? You suddenly realise it is a terrible, terrible plan. So I think this is a big thing, is not sort of, not just thinking we have a plan and yeah, there's a plan. Really work through what does that plan look like and what's going to actually happen when we do that. And it's really interesting. We did a big plan about 10 years ago. We were talking about Queen's Birthday Parade and what would happen as a high terrorist threat at the time. What was our veterinary plan for that? And it was kind of like, well, we'll bandage some things and then we'll send some back to the barracks and hopefully we'll find some horse boxes. But actually, we had to really sit down and work it through, from what would we actually do? Where will these horses go? What will we do with them? And it is more complicated than you think it's going to be. But also what you don't want is when it happens, you don't want conflict. So you don't want everyone thinking they know the plan, but everyone's plan is slightly different, because the time to have that argument is not while it's actually happening. It's now while we're thinking about it.
Yeah, it's a really, really good points there. And the next question was kind of what role can vets play in supporting community well-being during civil emergency? And did you have a question, Dave?
No, my bag is full. So just highlight the situations you have with brothers and grannies here.
Yes.
Really supportive for others here. But in fact, they had no, and obviously it's a bit more knows.
Yes.
Bill was there.
Yeah.
Of course, it gets running and people like that would come, and we were very lucky. It that we were able to, for those that don't know, I'm Group Head of Animal Welfare for overseas Evidentia, so they got dumped on my desk as to how can we support people with dementia with their animal welfare situation. We were able to create strategic plans, in part because exactly as you said, none of our surgeons had been wiped out, that we temporarily lost access to one single animal branch. It was only one single animal branch. It was having those things that we hadn't really thought about in advance. We were working backwards
Yes.
Things like, how do we contact the police and say, look, if you can get animals to us, we will sort them out for you. But who do you contact in that situation? You haven't really made those contacts.
Yeah.
Things like that was very difficult. And also that obviously transport, movement around the city, incredibly difficult. Not wanting to put any of our teams at risk, not wanting to cause further work for the emergency services who are really struggling, and needing realistically having access to a corps of people who've had some advanced training to be able to work with emergency services in dangerous, hazardous areas, because we were able to do the responses that they could get into us, but we weren't able to easily help them do the rescuing part. But also to have the knowledge as a veterinary professionals to deal with some of the things that you're seeing, which aren't quite what normally goes through the door.
Yeah.
So how are you dealing with dogs that have been in a river for 3 days?
Yes.
That are near drowned? How are you dealing with things that are really heavily contaminated in sewage, God knows what? And what are they going to do over the next few days, either medically and pathologically?
Yeah.
And how are you going to treat those animals? Because no one really had any knowledge. They've had to learn very quickly. From the ground, but it is really important. It's highlighted to me. It's really important. We need to think about this a whole lot more than we have done before.
Yeah.
And not just in the UK. It's a much bigger problem.
Yeah, and that's really why the international community of practice that we're developing is so important, because what vets are learning about animals in disasters in Australia and California and Brazil and all around the world, all of that medical knowledge needs to be kind of brought into a central conversation where we can actually grab that and take that and say, actually, if it happens to us, here is a set of guidelines. The dog's been in that. I mean, flood water is vile stuff. You know, it's gopping, horrible stuff. You know, we had a guy this week in Northants rang Nicola up to say, I've got cobs in water. They've been standing there for X amount of time. How long can they stay in that water? What is the trigger point? When do we have to move them? And then when if they need medical attention, what are the likely issues that are going to come across? So that's, yeah, absolutely. So.
Yeah, we're not usually very good at preparedness. We've seen that with COVID, with foot and mouth disease. Obviously, government vets here. Do we need to get to a position where we actually start to employ people who are there for these sort of situations? So should we be expanding, the number of government vets who aren't just people who come in, they're in practice and then they do some government work? And similarly, should the army be, should the RAVC be expanding? Because we know these floods, that have happened in Valencia and everywhere are only going to increase. Climate-related disasters are up 83% in the last 20 years. Yeah. So it's only going to become more common, isn't it? We're at mitigation stage now rather than stopping the climate emergency.
Yes. And it leads us nicely onto the role of the vet in supporting communities, because, as you say, this is all about collaboration. It's all about bringing your expertise and helping us to form a plan and cover all bases. And that's why I'm so keen that vets are involved with emergency planning. I don't think it's something that happens a lot. I certainly think in our local resilience forums, we need to be embedding a veterinary opinion in a lot of those discussions. And I know that's something we're going to be talking with Sheila's team in the Scotland context about in the near future. But I think, so here's two people I want to highlight. So Claudia Sonder is an equine vet from the Napa Valley. I worked with her at UC Davis. And this is Dr. Jay Kerr, who is a small animal vet. And here they are in the midst of preparedness and response to community events. Now, first of all, why is Claudia setting up a large animal response team? Okay, a community large animal response team. Well, the reason is that with all the goodwill, even if the fire and rescue service acknowledge the fact that their responders need to understand animal psychology, need to be able to interact with animals and rescue animals, they're not going to be able to cope with all of the logistics that are required to support animals in a disaster. So what we need to do is we need to form credible, accountable networks of people that can be called upon to help with some of those immediate needs. And so Claudia is, in her place in society, she is well respected, well trusted as a vet. And you know, vets have a really significant to play in the reassurance of our communities where their animals are involved. And so she's led this team, the development of this team, and what she brings to that is not just her medical knowledge, it's her compassion, it's the whole reason that she was a vet in the first place, was to help people and their animals. So I think there's a societal role for vets to play in encouraging and supporting and teaching communities how to be better prepared themselves, but also in helping to coordinate these this is essentially a vet-led team. You know, these people might not be veterinary professionals that she's leading, but they all have a professional role that are animal focused. And here's Jay. He's a very senior and very, you know, great vet bandaging a cat. Now you've got a question, is he the right person to be bandaging that? Is there a role that he should be performing, you know, more of command and control or logistics or support? Because as David said, there is a whole range of things that come to light when your power is disrupted, when you haven't got infrastructure in place to bring materials in or medical things. So you need people in positions that can step up and coordinate. And this is where, you know, we should be using vets, vet nurses, or even you know, animal welfare professionals under supervision.
Jim, I don't believe for a second a vet did those bandages.
Yeah. They're far too neat.
So this guy, when I was over at there, he is also on the board of directors of his local fire department near San Francisco. And he asked me to go down, do some training with his fire crew. About the same time, we had a request from South San Francisco Fire Department. They do the medical emergencies as well, human medical emergencies. They said, could UC Davis provide training for our teams, because we're dealing with cats, dogs, in car crashes, house fires. We need to give them oxygen. We don't know how much to give. We need to bandage them. We need to provide all these first aid things. And actually the university said, yeah, we'd love to. They've got all these ECC specialists there. And they said, yeah, we'd love to do that. And then the California Veterinary Medical Association said, oh, hang on, none of that can be done because it will contravene the Veterinary Practices Act. So in California, it was illegal, or was illegal, for anybody other than a vet or the owner to provide first aid for animals. So actually, these firefighters that are going to do it anyway, because that's the kind of people they are, were asking to do it well, but couldn't be taught how to do it well because it contravened the law. So I said to Jay, well, you know, I'm used to come up against barriers, Jay. Now, I don't know the law in the United States very well, but if I get a group of people together, do you think we can have a go at changing the law? So we went to the National Fire Chiefs Council and we told them what we wanted to do and we asked them to support it. And they said categorically, yes, it's only a good thing. Then we asked Jay and his team to get involved with the state legislators and get some senators on board. And they changed the law, and California to this day is the only state that has changed the law to say that first responders can give first aid to animals. I mean, simple things like oxygen, they weren't allowed to do legally. So all of these things are possible when good people get mobilised. So, yeah, that's just something I want to throw out there. So we've gone from a position where emergency responders would render humanitarian services when requested to, but it was a case of get everyone on, all hands on deck, get everyone round here, we've got a horse with clouds trapped, you know, let's have a go, this might work. Anyone got a tractor? Really was a haphazard way of dealing with this. To now, particularly for large animal rescues, we've got role-specific training, we've got structured teams, we've got standardised techniques, we've got protocols, and we've got veterinary integration at the centre of that tactical plan. And this is what we would call a casualty-centred rescue. In the old days, it was how do we drag that horse out of the ditch? Now, it's what is in the best interest of that casualty animal. And I think that's a really important thing to take home. So what are we asking from the profession, Adam? Get your pitch out there. What do we want these guys to help us with?
Yes, obviously we've got the role, the education and the preparedness, and we want the specific training and equipment, so that might be providing an ambulatory equine vet with the guidance to provide care to a small animal. It might be the pre-preparedness and planning or changes to legislation. We also have our pre-veterinary care guidance, which we've been slowly working on, sorry Jim, it's taken me a while, for a number of years, but we have our advisory panel. The role of the fellowship to speed up that process, we identified based on research in the United States of the 10 or 14 most common emergency incidents you might need to prepare for to work with the emergency services, and having a panel of experts to push that forward and develop that would be key to then being able to say to those vets that might respond, but also the emergency services, these are the things you need to consider and be able to do. So the dog that's been trapped in a car, don't just put it in a car and drive it to a practice. Use your access to running water as a firefighter and cool that animal down before it's moved. And depending on what the fire service has Googled, they may not have got that information. We know that's strongly evidence-based, that should be done first before that animal's moved. So replicating our oxygen therapy guidance, which we are very pleased got a runner-up in the RCVS Awards a number of years ago, but that's a fine example of how it works. So the fire service had access to oxygen masks that were provided by a community interest company, specifically for animals, but they weren't using them because they didn't have the training package there, and vets weren't aware that they carried them in their vehicles. So by improving that training, the larger fire organisations like the London Fire Brigade were then suddenly putting them on 100 engines, and then within a few weeks to months there was many examples of how they were saving lives and improving the welfare of animals caught in house fires. But fire is the one that everyone thinks of with the fire service, but all these other incidents we've talked about today, and how we can improve the packages around what care is provided. And I think one of the questions from the audience was the animals in floods, and there's lots of evidence-based literature on other countries where they already have everything in place, and actually making sure vets in the UK have access to evidence-based guidelines of what to do with the animal when it's been trapped in floodwater for 3 or 4 days, or the animal that's been in wildfire. There's all that evidence there, and we need to apply it to a UK legislative setting. So you can't necessarily immediately transfer what's happening in the US to the UK. We need to develop guidance that fits with how our emergency services understand how they can work. So making sure what we ask them to do is situation specific. It's not going to be in a clinic. It's probably going to be on the side of the A1 or M3. And considering also, I was speaking to, I don't think he's in the audience, Lord Sandy Treece last night, about the economic impact. So if a major highway is closed for an hour, it costs £1 million. And if the animals are causing that highway to be shut for 2 or 3 hours, there's a clear need to prepare for that and plan. And all those other things in point 4, reach back and telehealth. Obviously, telehealth can be good or bad, depending on your point of view. But in terms of a firefighter getting expert advice from a veterinary professional to give guidance of what's best to do, whether those animals are viable, what treatment and care they may need, there's a huge resource there that we could tap into. The fellowship has a huge number of people that would probably want to contribute to an expert panel that could provide that kind of emergency advice. And how the scope of veterinary nurses and vets interact with the emergency services would be a key part of any of that review. And I don't know if you've got any other comments, Nikki, because, of course, as a large animal vet, there's a huge difference to what you might do.
Yeah, I mean, I think for me, there's a big bit of education for the veterinary profession about what does this actually mean for us, both on a bigger scale and on an individual note. So I think the understanding behind the impact of a large-scale emergency or disaster, what impact is that actually going to have on a community? So if you look at learnings from international disasters, you know, there's a massive impact on productivity, on mental well-being of people, but also when we kind of look at that bigger picture, you sort of look at some of these big disasters that have happened abroad, and you've lost, you know, millions of animals have been lost. So there's a real sort of ability to understand, well, what does that actually mean when you lose millions of animals? Because obviously you've lost that immediate productivity, so you've lost your working animals, your meat and milk producers, or you know, you might have lost the family dog. You know, but all of these things have an impact at different levels. But also then it's not simply a case of just being able to replace those animals, because when you look at these big replacement programs, they don't work, because actually those animals don't have that natural immunity, they're not adapted to that land. So there's actually big problems with this. So the economic loss is both immediate but also long term. And I think probably, and I maybe use myself as an example, I hope everyone else in the profession is much better educated than me, but this took me a long time to actually understand this really big impact on this and just how important this is. And I think, you know, that's the first step is understanding what this actually means and what this looks like, and actually how important our role is in getting this right is the first thing. And then we can think about, well, what do we actually do to make sure we get this right, which is of course a big question, but the first step is just acknowledging that it is going to happen to us and we need to be ready for it and we need to start thinking about it now.
That's right.
So when I started this all those years ago, it was a very practical issue that we were dealing with, a safety issue. And we would get the animal out, and if it wouldn't stand up, we might think about calling a vet. Now the vets are embedded right at the outset, as I said earlier. And I think what we now need to start looking at is the type of incidents or the type of engagement that the vet will need to be part of. And what tasks are required. Let's define the role of a veterinary responder. And I say a veterinary responder rather than a veterinary surgeon because we talked about the potential role for vet-led teams. This cat in the window, that needs to be got out of that situation as quickly as possible. But many of these situations, they just need short duration sedation to allow us to get it out in an effective way so we can get it to definitive veterinary care. Because we can't get a vet to that job in a timely fashion, that animal remains in that position because with crush injuries, in human terms, we're not going to start releasing people with crush injuries because of the physiological impact that might cause. So we need some guidance. Yeah, this is where Adam's kind of pre-veterinary care guidance really kicks in. What does that look like? Can we take a picture of that or video it and send it to a vet? Or could you send a veterinary nurse out to sedate it and then transport it back to the clinic? Those are questions we need to ask. What resources could be sent is really important. And the question I throw out there to you guys is, should the veterinary profession be actively planning to support these events? So I think that's maybe our final kind of thing. You know, what is your opinion, perhaps having spent some time with us this afternoon? What does that look like for you? Where do you feel that vets fit into this emergency planning? Sheila, what was your take home?
Yes, absolutely. I think we should. There's a question about planning for us as vets, but also planning for animal owners. And one of the things that we're doing is working with NFU Scotland to try to get farmers at least to start thinking about what might happen if there's a flood, if the river bursts its banks, or if there's a fire in their buildings. But I think as vets we could do an awful lot more and get organised and be ready to help and understand what our role might be.
Thanks, Sheila. It's really interesting. We've got a friend in a vet in Holland, and they've been doing some modelling with the government around an area. They picked an area of land. It's about, I don't know, 50 hectares or something like that, and then around it have got a lot of water courses where there could be breaches if there was spate weather conditions. And they've been trying to do some modelling as to if it breached here, how quickly would those farmers be impacted? And they've almost got like this traffic light system. And then you've got to start thinking, well, let's say there's 200,000 animals in an area, farm animals. If you were going to start planning to remove those animals if there was a risk of flood, well, what does that look like in real terms, you know? Because there's only going to be limited transporters, so who gets the transporter first? You know, when they get to a place of safety, is that going to breach disease movement restrictions? Well, clearly it would be here. How are you going to milk those animals that are going to be needing milking very shortly? You know, and you start to look at the logistics of that, and it really starts to stack up. So then you've got to balance this. Well, if we're saying that that's logistically not feasible, then we've got to have another plan. Are we going to allow them to drown, or are we going to provide mass euthanasia? And so then you start to get into that kind of social question about what is appropriate for us to think is a plan. I've just been doing some work with the RSPCA around evacuation plans for their animal centres. A lot of the kennels are full of dogs that are of dubious character, shall we say. And when I asked them, okay, so let's consider if we can have an evacuation plan, and they're saying to me that some of these animals are not compatible with each other and they require trained people in order to handle them. So I say, 2 o'clock in the morning, are those trained people going to be there? And have you got sufficient refuges? And the answer simply is that that is not feasible. And you're going to put people and the animals at more risk by moving them. So, okay, that's not feasible, so what's our plan? And our plan, as we've been discussing, is if you've got a kennel block that's got a nice corridor, can we get the animals firstly into the run, where they've got access to clean air and there's less flammable materials, but also the fire service can use a positive pressure ventilation fan, and they can create a draft through with this very fierce fan. It's just like we do when we fight house fires these days. Before we go into that smoke where we can't see anything, we investigate whether we can open a window, put the fan on, blow all the rubbish out of the window, which makes it more tenable for the person that might be in the house and better for us to do our job. So what the plan is probably going to be is to have this system in place whereby the fire service understand that if a fire is impacting on the kennels, we will put the fan on and we will pressurise it. And we will leave those animals in situ. But you have to have thought about that beforehand, because there's no good them having a situation where animals are injured and you go, well, you know, we didn't have a plan. You know, so it's really, really important work that the RSPCA are doing at the moment, because this is a legal capability gap. So we all have fire safety legislation now which thinks about human safety, but they don't think about animal evacuation. There's no one saying you need to have an animal evacuation plan in most contexts. So what we're doing with the RSPCA in actually starting to develop this guidance is something that the RSPCA will be able to say to other animal establishments, these are good practices, we have gone through this with our vets and with our animal welfare staff and with our emergency responders, and this is what we feel is appropriate and applicable. So some really good work going on, but it does highlight the fact that, you know, until you start to unpick it, what will happen in reality, then it will be that kind of chaotic
Well, I
approach.
think the other thing is the result of that is people get hurt because there is no plan and people will put themselves in danger.
Well, and animal professionals, you know, they will feel responsible. So we have a responsibility to our staff and our teams to say, this is what we've collectively agreed will be the plan. Okay? So if the fire service turn up and say, we need to rescue those animals, you are all on the same footing. And you're all saying this is not safe, it's not appropriate, and this is what we have pre-planned to do. That means that everyone's going to go away from that situation much more relaxed with what they've done, and you will have justification and a rationale for what's gone on. Yeah. So, any other comments, Madam?
Yeah, thank you so much for that. Like, I was in that hospital, on top left, inside, when that happened, and yeah, every animal was out without a problem. And one of the most stressful part was exactly what you said. Everyone wanted to have all these animals out of the hospital, and we were not allowed to get into the hospital once we were out, and all the animals should have left behind.
Yes.
With an anesthetic protocol while we were all leaving the hospital, that was not going to happen. And that is stress that create, I mean, to be honest, handling the animals, yeah, they were all, some barking, some were intubated. Like, that was I found much easier to handle as vets and nurses. Like, everyone knew who was in charge and who was going to do their part as a vet, but not having a contingency plan about what to do with the animals left behind, it was impossible to manage. Like, there was no way that anyone in that hospital would have left an animal behind.
Yes.
And knowing that there is, for example, that type of plans. Okay, so if an animal is behind, who is going to rescue that animal?
Yep.
Because in that specific day, that was the big.
So it's no different to a hospital. We're not going to get everyone out of the hospital when there's when the fire alarm goes off because someone's burned the toast. So you need to know, is it a credible fire? Have we got infrastructure that's going to protect them in place for a period of time? Yes, we have. Yes, we have. Yes, we have. And so, you know, that's a really important thing, is to have established with the emergency services and with your own teams what is feasible and what is
And that they know that there is a plan there.
Yeah.
And it's obviously about continuity of the practice as well, because how long was the practice closed for after that?
So we reopened in September, and that was, continuity, with the cases. Yeah, that was tough, yeah.
Yeah, I think in the end it was closed for 3 or 4 months from the time of the fire.
From March to September,
Yeah. So obviously as a profession, planning for what would happen to our practices is also really important as well.
You know, conscious of time.
Yeah, well, your timing has been immaculate.
There you go.
Your presentation has been immaculate, and I think it's been so fascinating. And I salute you guys for the work you're doing. I think it's tremendous, and it's progressive, and this is the future. This is how we have to proceed. And I'm hoping, really strongly hoping, the fellowship can play a role in this and actually help produce, from our side too, some tangible outcomes to actually drive this work forward as well. So really, I want to thank you, for this fantastic talk. It's been really, really insightful. Thank you very much.
Thank you for your participation.